Hello everyone, this is Alvina. Understanding the ECG basics is an absolutely vital for healthcare. So today we're gonna break down the essentials of ECG interpretations. Now let me make it clear. ECG can be overwhelming at first, but it's crucial to grasp the basics, especially the key things we need to spot while working in an emergency or cardiac unit. So this is the normal ECG pattern. You can see here we have P wave, QRS complex and T wave. Now we'll start by checking the rhythm to see if it is regular or irregular. To do this, place the clean paper along the ECG strip. Now mark the peaks of few consecutive QRS complexes on the paper. Then move the paper along the strip to compare the marks with the QRS complexes. If the mark lines up perfectly, the rhythm is regular. Here, if the marks don't match up exactly, then the peaks fall a bit before or after the marks, the rhythm is irregular. Now let's learn how to calculate the rate from an ECG, starting with regular and then moving on irregular rhythms. For regular rhythm, we can use the formula 300 divided by the number of large squares between two RR waves. Here these are 4 boxes and we'll divide 300 to 4 is 75. So it's having the rate 75. Guys, we have another method for calculating the heart rate that is called quick reference method, and it's also for regular rhythm. Okay, so here each large box on ECG paper represent different numbers. For instance, if there is one large box between two peaks and the rate is 300 beats per minute, 2 boxes equal to 150 beats per minute, 3 boxes represent 100 beats per minute, 4 boxes equal to 75 beats per minute, and so on. So just remember these values to make quick calculations. Sometimes peaks do not come at the proper site, and then we will count one large box by counting 5 small boxes. Now let's talk about how to calculate the heart rate from irregular rhythm. We'll start by taking a 6-second strip of ECG, which is equal to 30 large boxes. Then we count the number of R spikes, R peaks within 30 large boxes. Once we have 30 large boxes, then we're gonna count the R waves. Okay, now once we have that number, we'll multiply it with 10. Here I have 7 R spikes within 30 large boxes. Then I've multiplied it with 10, that is equal to 70. So 70 is the heart rate within 60 seconds. I've multiplied it with 10 because I scaled up 6 seconds to 60 seconds, 1 minute. Now let's have a look on sinus rhythm. This is the normal ECG. You can see all the waves including P, QRS complexes and T wave are present. Heart rate is within the normal range and the rhythm is regular. This rhythm you can see is sinus tachycardia because heart rate you can see is around 150 beats per minute, that is above normal. So this is sinus tachycardia. Now we'll have a look on sinus pericardia. It's pericardia because the distance between two R waves is longer, indicating slower heart rate. Typically the normal heart rate is 60 to 100 beats per minute. Well, if the heart rate is below 60, that is called bradycardia. The next step in reviewing an ECG is to check P wave. First we'll see the P wave is present or not. In some arrhythmias like atrial fibrillation, the P wave might be absent or irregular. If the P wave is present, we need to assess is it normal or not. It's really important because it tells about atrial depolarization. Are they depolarizing properly or not? Okay, normal P wave should be upright and its duration should be less than 3 small squares. Next, we'll examine the QRS complex. QRS complex should be narrow and it should be within normal range, that is 1.5 to 2.5 small squares on an ECG. If it is wider, it could indicate a serious problem like left bundle branch block. It's really important to check QRS complex because it indicates ventricular functioning, arrhythmias, bundle branch block, or some kind of myocardial infarctions as well. Now let's look at ST segment. It helps us to identify the myocardial infarctions. Okay, there are 2 types of heart attacks. STEMI and NSTEMI. In STEMI, the ST segment is elevated. In NSTEMI, there are T wave changes or ST segment changes, but there isn't any classic elevation as in STEMI. Okay, based on there are 4 types of STEMI. According to the location of elevation, ST elevation indifferently suggests infarction in interior, inferior, lateral, and posterior wall of heart muscles. Now let's review some common arrhythmias. First, we have VTAC. Ventricular tachycardia is a serious emergency where we often need to administer shock and refer the patient to the cardiac unit. Next, we have ventricular fibrillation. Is characterized by this pattern and with no distinct Curus complex. If there is a P wave and rapid rate, it might be supraventricular tachycardia, SVT. Then there is AFib. AFib is characterized by irregular pattern and with no P wave. Next, we often see myocardial infarctions with the ST elevation. Thanks for watching. Don't forget to subscribe my channel and hit the bell icon to stay updated.